speak also, as I said, to Richard Sloggett, special advisor, who was a special advisor to the Secretary of State for Health. Good morning to you, Richard.
Good morning.
How easy is it going to be to carry the public with them for the government on this vaccine? I mean, this is a good news story, but obviously there are lots of ifs and buts and caveats.
Yeah, absolutely. And I think the logistical challenges have been very clearly set out by Clio, but the public confidence is going to be really important for this. And if you look at where we were before the pandemic on vaccine attitudes, vaccine hesitancy, so reluctance to take up vaccines, was listed as one of the top public health risks by the World Health Organization. And the UK had lost its World Health Organization measles-free status in August 2019. And there's evidence around the world that actually the uptake of vaccines has been falling. So we go into this whole episode with actually some concerns amongst the public around the effectiveness of vaccines. And if you look at some of the recent polling that's been done, there's been lots of polling, but I was struck by a YouGov poll which came out recently, which said that 65% of people would take up the vaccine, but 1 in 7, 14% would not, and 21% don't know whether they would or not. So there's a huge public relations communications exercise here, which is going to be very, very important from a government perspective.
Is this, to be very kind of clumsy about it, is this as simple as important people, high profile people having the vaccine on camera, or for example, would that help?
So I think what you need so there's a few things to this. One is you need very simple messaging. So the optics of making it really clear what you're asking the public to do and how they can access the vaccines, because access is one of actually the biggest barriers. And again, it was touched on in Cleo's remarks. Yeah. We need different ways for people to access it as quickly as possible. Now, the speed at which this vaccine is being developed will lead those who don't want it to succeed to make claims about it. So there's a whole sort of social media angle to this, which is the social media companies, the government need to work very closely on stamping out fake news and spreading, and it can spread very, very quickly. So the whole sort of social media side needs to come through very, very clearly. And the other interesting thing on this is, of the 21% who don't know whether they would take one up or not, some of that is that there is a scale of what's called anti-vaxxers. There's those who believe in the sort of conspiracy end of the spectrum, but there are a lot of people who are maybe worried parents or just worried relatives who are concerned about the information they're given, and they need it in a clear way. And I think on that, I think the best thing to do is to emphasise the safety elements of the vaccine rather than the risks. So going with a message of the vaccine has high levels of safety rather than it is low risk, that could also help you in driving your uptake and public confidence. But there's a huge job here in terms of not only logistically, but also in public relations, communications terms for government.
And finally, I saw a list yesterday of the kind of expected priority regarding who gets it first. Care workers, the vulnerable, the elderly, and then in terms of age, it kind of goes down, 80, 70, etc., etc. Do you expect there to be discussions, arguments about who gets it? Because there's some controversy, for example, over the effect of coronavirus on, for example, people from Black and Asian communities.
I do expect there to be a public debate of this, but I think the UK has a history of grounding these decisions in clinical decision making. So if you look at a body such as the National Institute for Clinical Excellence, which looks at medicines for the NHS and does assessments of whether medicines are effective for patients, and that is independent of government, I think the kind of independence and clinical need has to drive the decision making. But of course, there will be a public debate about who should get the vaccine and when, because this is a public health emergency and there is public money being spent. So I expect that debate to happen, but I think grounding this thing in clinical need is really, really important.
Richard, thank you very much. That's Richard Sloggett, who is now a senior fellow at the Policy Exchange think tank.